Hello, I'm Dr. Megor, and it gives me great pleasure to welcome you to this special series. It's My Belle Chronicles. Yes. Now, I'm a medical doctor, an early childhood care and development specialist, as well as a family life strategist. Did I also mention that I'm a wife and a mom to 3 kids with number 4 on the way? Yes, you heard me right. Today is very special because we have a guest in the house. She's my personal OBGYN. If you want to know what that is, it means obstetrician and gynecologist, Dr. Chito Nwana. You're welcome, Dr. Chito.
Nice to be here.
Thank you so much for making this. Dr. Chito is, you can imagine now, she's my obstetrician, so she's the best. And out of her busy schedule, she made time out to come here, and we're hoping that we can really break things down today, especially for women like us in this part of the world. We live in Nigeria, and there's so many African women out there that sometimes we don't get the exact content that actually suits our own peculiar situations. And so today we're going to be talking about the first trimester. Okay, so Dr. Chito, I would like to ask you first of all, there's so many gists and stories surrounding the first trimester, what you should do, what you should not do, why you can't. So can you talk about what is it really about the first trimester? Why is there so much noise about it? The first trimester, by the way, sorry, in case you don't know, is the first 3 months thereabout of conception. So
I'll start by defining. So the first trimester ends at week 13, right? And I think the whole excitement about the first trimester is because the first step of the journey, right? The thing that we talk about a lot, I emphasize about the first trimester to those that are planning to become pregnant, is that we always have to know that by the time we know we're pregnant, we have already started the first trimester, right? So by the time we realize we're pregnant and we've missed our period, you're already about 5 weeks pregnant. So it starts before we know it.
I see.
And that's something that I think is very important because we need to, when we're trying to get pregnant, most times it's oops, right? Most times we just find out we're pregnant. And I think, many people are okay. But a lot of times we try to tell people that if you're trying to get pregnant, you must live your life, your health, what you take into you must be as safe as it is if you were pregnant, because you wouldn't know
when you got pregnant. Exactly.
And that's what I was talking about, preconception.
Yes, that's true. How important is that really? Because in your practice, tell me, how common is it in this part of the world?
I think I promote it very, very much so. Especially here, because there are a lot of things that we take culturally or take, in our foods that we don't know could affect us.
I see.
There are a lot of things that we eat that we don't know could affect. And I tell people that all women that come to me still wanting to get pregnant, still in the baby making age or stage, I always counsel them on, in case you get pregnant, you're not on any family planning. Once you're not on any family planning, you can get pregnant.
I see.
So I counsel you on what to do and how to keep yourself and your body healthy, just in case you get pregnant. Like, remember when I told you about the fish?
Yes.
So many people don't know that there's kinds of fish that are not that safe for you in pregnancy, and those are ocean fish, like the king mackerel fish, for example. I know most of us eat catfish and tilapia, and that's fine.
Why is it fine? Because grown in the pond.
The ocean fish have mercury. Right.
So is it all of them that have mercury?
Most of the fish that are gotten from the ocean have the mercury from the water. You know what I mean? So if you eat a lot of that fish, you ingest a lot of mercury,
which is very dangerous for the baby.
Which is not really safe for the fetus. So simple things like that. But again, catfish, let me just say that our common fish are pretty much
catfish and tilapia are fine, right? But the one we call Titus, or they also call it Titus or Scubia.
Titus, let me think, because I have to memorize. Even when you're in the room and I'm trying to think of what fish are healthy.
What's it called?
I have to look it up. So I know mackerel for sure. I know the swordfish is also part of it, found in the ocean. But I always tell, because there are great sites out there to check. If you look at Mayo Clinic or Helpline, they'll tell you lists of fishes that are kind of safe and those that are not safe. Yeah. But also when you talk about alcohol or those that smoke. Or those that are particular drugs, for example, like for us women that are doing things for our skin, there are certain components of like retinol that you should not take when you're pregnant. In fact, when people are put on the retinol cream, they must be on some form of family plan.
Absolutely.
Because that actually could cause harm to your fetus. All right. So these are the kind of things we talk about preconception counseling. We also talk about what it means to be pregnant and how to financially plan for your pregnancy, how to emotionally plan for your pregnancy, how to build your support system, and all these things that make this journey and this beautiful journey even more beautiful.
Exactly.
So that is something that we talk about before you get into your pregnancy stage. For the first trimester, it's a period of change of your body.
Yeah.
A lot of things are changing, right? You're feeling a lot tired. You're fatigued. You're weaker than before.
Please, Dr. Chito, can you explain why? Because it's funny. It's not the last trimester, so it's not like you're carrying so much load. In fact, nobody knows you're pregnant. That's the most annoying thing. So if you're at work or whatever, but now you're just sickly and you're just tired all the time and you're nauseous and all of that. What is really going on in the body that causes that level of, symptoms?
The same hormones that keep the pregnancy intact is the same hormones that get in your body weak and tired.
Yeah.
So like progesterone is a hormone that's really high in that first part of the trimester, right? It helps to maintain the pregnancy.
Yeah.
So because of that, it causes a lot of fatigue. It causes you to be really tired. For the nausea and vomiting, we normally see that as caused by what we call HCG, human chorionic gonadotrophin. I'm not biting my tongue, but HCG. And that is also increased at that first stage. It keeps rising in your first trimester, but it's also important for maintaining the pregnancy.
Yeah.
So that causes the nausea and vomiting. When I have patients that come in, I'm like, this is really caused by what maintains the pregnancy. And when they come, I don't think I feel that nauseous. Please check. It's not getting worried about how they feel. But yes, it goes up high, it plateaus, and then starts to come down a bit, and then but that is why we feel that way. Okay. Most times our body changes based on these hormones.
I see.
All right. And also we have changes based on our blood volume. So a lot of things change in our body. The way our blood, lane terms, flows. Our breast gets tender too. You start feeling a lot of tenderness in your breasts. And I think by far the most common complaints I receive in pregnancy is the nausea and vomiting.
Yes.
And that happens in 80% of women.
Wow.
But it's bad in a smaller, really bad.
Exactly. I wanted us to just talk a bit about hyperemesis gravidarum, which most people don't know, but they might not know what it's called.
But you're nauseous and
all
you
the
cannot
time.
tolerate food, you vomit a lot.
And then unfortunately theirs doesn't seem to plateau and then, fizzle out. For some, it actually lasts until the last day of the pregnancy. I know.
Very few though, a very low percentage will continue with the nausea and vomiting to the end of pregnancy. And they're just sensitive to the progesterone and stuff like that, not just the HCG. But most people, it does fizzle off by the 13th week.
I see. Yeah.
We get into the second trimester and you get a better sense of energy. Yes. I love the second trimester as an OB and as a mom. Yes. I love the second trimester. You get that boost of energy. But first trimester is really that when they get really sick, when the level and the sensitivity, some people are tolerant to it and do well. Some will just have a little nausea, all right?
But they can cope.
But they can cope with it. They don't have any vomiting. Some people will only have the nausea if they smell certain foods. Some people say it was morning sickness, so they think, why am I getting it in the afternoon? And that's something I guess we'll talk about later in terms of myths, but morning sickness, but it doesn't
It's
only
not
occur
in the morning.
It just worse
Absolutely.
in the morning.
Yeah.
So some people can't even get to the extreme where they can't even drink water. And when it gets that bad, is when we actually start admitting them in the hospital and managing that hyperemesis in a way that they can actually tolerate the first trimester, because we don't want anybody giving up on their first trimester.
Exactly, you know. So I wanted to say, so what are the ways someone who has such severe nausea and vomiting, what are the ways they can manage this? But I think one of the things you've just highlighted, they need to be rather close to their hospitals and their doctors. I don't mean just physical proximity, but so that when they need to come in, because to guard against things like dehydration and then all other things that can come up from that, because from time to time they may need intervention, right?
That's true. So I always try first to advise them to start with natural things, right?
Okay.
So that's either avoiding fatty and spicy food, which is kind of hard because of the taste of the tongue. People feel like, especially in our culture,
that's what you want.
That they want that spicy thing, that's pepper, they want it, but it makes your nausea worse.
I see.
So another thing I try to do is talk about using ginger products like ginger ale or whatever you have here, like ginger tea. But again, in moderation. Everything has to be in moderation. I try and get my mom to say, okay, when you wake up in the morning, and this is not even a medical advice. I think, you know, being that I was also a patient of hyperemesis, I always add things that worked for me. So I'm like, when you get up in the morning, have like crackers by your bed, put something in before you actually do get up, eat something. That usually helps. But when all fails, we intervene by giving some medications. You know, and also before I forget, we get people to eat frequent small meals.
Absolutely.
You know that thing where you're hungry and you said bring pounded yam. You could feel sick all day when you know, or you want to eat.
You feel the
like
need
you feel like the meal you eat.
I remember
you feel
sitting down and finishing 4 wraps of amala in my first trimester. I was like, I don't think
I've ever had the cravings, right?
Yes. Yeah. At the same time, but yes, at the end, you don't feel that good. You don't feel.
You feel even sick and sicker than you were before, and so I always tell people just try small meals, frequent small meals. That allows your stomach to settle a little bit. If all fails, we have to intervene with medication that we have. Those that are really bad, that can't even tolerate water. You see them, they lose weight. Those we get concerned once you're losing weight or not tolerating any water or anything like that. We bring you in and then we give you some IV fluids and we manage you like that so we can see you tolerate something. Because it's important that you eat something or drink something on your own. So that's the extreme cases of hyperemesis. Hyperemesis is that thing that we watch out for, because you keep vomiting without any intervention. You get really,
you're just
really
losing.
Sick. You're losing your electrolytes. You're losing fluid. You're losing weight. So that's when we intervene.
Okay, sounds good. Thank you. And just to take you back a bit, when you talked about smoking, you know, talking about things to avoid. In the first trimester, we talked about types of food. We talked about what about smoking? I mean, what if you are not the one smoking, but maybe your husband smokes or there's someone in the house that smokes? How does that affect?
You know, I think all through, whether the pregnancy and beyond, secondhand smoke is a major issue. And I think if you have a partner or husband that smokes, they should please step out. And they relegate them to the balcony or to outside as a rule.
Do it there as a
rule. You can use this time and opportunity to stop smoking or you're out. And I think that should be the rule from then on, even when your child is born. Because smoking does cause your babies to be born smaller. And when they're born smaller than they should be, it's not a healthy place for a baby to be, right? So because of that, smoking is something we consider to reduce. And also caffeine. I mean, I'm a coffee drinker.
Me too.
And I'm trying to, you know, I go cold turkey sometimes, no coffee, just tea, and I come back. You know, and that's something that must be limited, which I always try to permit, like 1 cup of coffee
a day. So
I believe the cup is 200 milligrams.
I think it's 200 milligrams. Because it's funny you should mention coffee, because when I first found myself pregnant, actually, I realized I was afraid because I was drinking. I mean, I'd been a coffee person, but luckily in that nausea, the first trimester, I found myself with a strong aversion to it, so that helped.
But
I know before that set in, I went to do some research to say, please, how much is okay?
Yes.
You know, and it was about that 200 milligrams though. When I found, I got our coffee around here and I was trying to see if it was written. It wasn't written, you know, that caffeine, how many milligrams was contained inside. So I think, just limiting it to like
one, so it's just easier.
Cup.
You know, I found that talking to patients and make it as simple as possible.
Exactly.
Just say 1 cup a day.
Yes.
And you know that, it might not be up to the maximum, but you don't want to be up to the maximum. So I just say 1 cup a day, and if you can't do without it, just move to tea. Tea has lesser caffeine content, and then you can do 1 or 2 cups of tea. If you're someone that just wants to drink something hot. But you're right, I was pregnant, I couldn't drink anything. I was cold, ice cold water only. I know. But I think you know, that's one of the things I look at in terms of what you should avoid in pregnancy. And of course, exercise. Don't stop exercising.
Okay, so that's an interesting one now. Yeah, so don't stop or don't. So it's a mixture of don't stop if you have been exercising before.
What I say is if you're already exercising and there's nothing that we feel contradicts, you know, that will make you stop you from exercising. Go ahead.
Okay.
Right. If you've never exercised and you say, you know, I want to start, then it's better to just be on a more moderate level of exercise.
More like mild.
Mild to moderate. Like you do brisk walk. I wouldn't want to start lifting weights.
Exactly. Or doing squats and stuff like that.
But if you're already doing certain things, then we'll just adjust your program not to include things that may affect your pregnancy. Unless something happens down the road, which many things could happen, then we'll now have to put you on some checks. But exercise is really always recommended during pregnancy. You know, to at least prevent excess weight gain, to keep your body healthy, prepare your pelvis for delivery over time. So I think it's something that we encourage.
And I think it also really helps with the mood, to lift your mood.
Because you know that in first trimester you start getting that mood swing. Someone tells you one little thing and you find yourself crying and shouting and wondering
what's going on?
Why am I so emotional? You know, someone hurts you that normally you just have talked. And then all of a sudden you are breaking down in tears. So a lot of times that's the progesterone though. I mean, that's one excuse I give women. If your husband is eyeing you, say, I'm just sorry, the hormones. And that's something that we always say happens, and we're very watchful though on a serious note about depression in pregnancy. There's a high incidence of people being depressed in pregnancy, and we try to make sure on every visit we look at that and manage that, like your mood, how are you coping, you know? If you're down, we counsel you and you get treatment for it. So I don't see much in Nigeria, but I think that comes with the natural stigma around mental health. But when I practice in the US, it's a lot. It's a lot more. But here, you don't see that much of people coming out. You have to draw it out. I don't think you're looking happy today. Are you okay? And then by the time you know it, you actually have to draw that out. Because we know that your outcomes, a great pregnancy outcome also has a lot to do with your mental health. So,
and now that you mentioned the difference between a place like the US and Nigeria, because you've practiced them both, and that you see, could another reason why we don't see depression in pregnancy, and even by extension postpartum depression as much, be our normal cultural construct where we have better family support? Because I know, I mean, this is, I think we'll still talk about this in another video. It's a whole other topic. Is like serious family support, you know, because when a woman is pregnant, those first few months, she needs a lot of help. She needs a lot of support, and you know, sometimes
imagine how you will feel being pregnant with 3 kids.
Hey, thank you. No, you know, we're going to talk about that in another. With no support, you can imagine how with 3 kids and then having the 4th on the way, it can be crazy. I mean, anybody will be depressed. So and this is for women out there. I think we still have women who tend to have this superwoman
tendency,
mindset of doing everything, and then you begin to feel like a failure if you're not able to. And we're saying no, it's okay to get help, it's okay to accept help. In fact, you should set up your home and everything in such a way that you do have the necessary help and people to support you and do certain things for you when you need it. I think that also helps to reduce the incidence of depression.
Support system is important, I think, when it comes to, I think that's something they were right about that. An expression of, I think also, we're more, in the US, they're more expressive of how they feel than here.
Okay, true.
That's another thing. So, because honestly, with the way our climate is right now, even here, it's stressful generally.
It is. Oh, yes.
There's already a natural stress level. Yes. And then you add that pregnancy and it's just
goes through the roof.
Yeah.
Okay, fantastic. So the next question I want to ask is, what are the warning signs, right, that a woman should look out for in the first trimester? Why should she, definitely have to go and call her doctor? And is it even necessary for her to have registered in the hospital and be seeing a doctor in the first trimester? Is it important?
Yeah, I mean, I think first of all, let me answer the last question first, but antenatal care is very important.
Okay.
We normally start antenatal care I normally recommend it between 10 to 12 weeks, right? Okay. So it's actually at the ending of your first trimester that you will start your regular antenatal care.
Okay.
People come in just to confirm, am I really pregnant? Is the baby okay?
Yes.
Where is was it in the right place?
Yes.
And that's important. But antenatal care allows us in the beginning to understand what your risks are, what issues you may have, based on your history, based on our exams, and it allows us to plan a safer pregnancy for you. Those tests that we do, the blood tests, they're not for fancy. Each one is looking out for something. And it also importantly allows us to know the true age of your fetus.
Yes.
We date that pregnancy because certain things happen at certain ages, and there's a management. Our management is also tied in to what's the gestational age of your fetus. Where are we now? Are we first? Are we second? Are we third? And a lot of times when you hear about mortality, neonatal mortality, or when babies die inside, so fetal demise, we find out because maybe, for example, a woman who has diabetes in pregnancy, we don't know you have diabetes. At the same time, the diabetes increases your risk of having a stillbirth.
Yes.
So we could have prevented the stillbirth if you were coming for your antenatal. Or for pregnancies that develop high blood pressure. High blood pressure that goes to preeclampsia not only risks the life of your baby, but you.
Absolutely.
So we find out sometimes in the rural areas here where we practice, we have people rushing in with women that are seasoned. Who have never gone, and you see this blood pressure is high, but she has never seen a doctor, never knew she had. But if we did see that before, you manage it. And I would say that mothers that have had babies before are really guilty of being nonchalant about antenatal care because they've done this before. I know my body. But it's important to check your blood pressure and make sure you're not having infection. There's so many things that we can avoid if you come for your antenatal care. That's important. Advising you, directing you, going through the journey with a health provider is important. I think for a good outcome.
I think so too.
And then your other question about when to call the doctor. Well, most times when patients are in their first trimester, I'll tell them, call me if you're bleeding. All right. It's important that I know why you're bleeding. Sometimes it's just for reasons like maybe you had sexual intercourse and you bled, or it could be an infection that I could treat. Something a little worse than that, like a miscarriage. But we also have threatened miscarriages. Even though I would say there's nothing you could do for someone that's actually miscarrying, right? Nothing humanly you can do if you're actually miscarrying. The
process has set
but at the same time, we can manage that too in a way in terms of avoiding it getting bad or bleeding at home. And cause anxiety for the mom if they see blood. We also have implantation bleeding that's just normal. But we want to know what is causing your bleeding, so that's one. Two, if you have any kind of abdominal pain or cramping, that's important. And as you progress a bit in pregnancy, we'll talk about if you have leaking of water, that's important. Because the water is what's around the baby, so if it comes down, we have to make sure it's not water around the baby. Sometimes just urine, but we have to make sure. And any other symptoms, like going through fever, anything that I think my patients are like, you just want to call me. If you're anxious, call me. You know, I'm very open to them calling me whenever.
Yes.
So I try to know that it's a burden. So just these are the things that you must call me in case you're laid back.
Yes.
But then if you have a question, then call me.
You can also call me.
Before you buy a drug that I didn't prescribe, call me.
Fantastic. I mean, I also think that, I mean, the choice of a doctor, maybe we'll talk about that in further episodes, is also very important, you know, because, I mean, you just saying this, the ease and, you know, the access that your patients have to you. I know, I mean, I'm a doctor too, and I know that that's not normal. That's not with all. Yeah. So, and I think that depending on your pregnancy and your needs, you should actually look for the kind of doctor that you can have access to. Because I've heard someone say, oh, when they come to the hospital, their doctor is always in such a hurry or something, and they want all their questions just flying out of their head when they come for antenatal clinics and stuff like that. So I think it's important to find a doctor that you're comfortable with, you know, where you can, as much as possible, where you can, and then that you can freely ask questions with questions and get your answers. Yeah. So thank you, Dr. Chito. Well, just before we leave, I think let's talk a bit about multivitamins. Yes, in the first trimester. So why is it important? And I think these are one of the things you said. In fact, if you are not on any family plan, like if you could be getting pregnant, we know that things like folic acid, you know, you shouldn't be deficient in it and stuff like that. But why? Because I mean, sometimes those multivitamins are not just easy to swallow, especially with the nausea. Yes. Right. So why is it important? Why should we take it? And if for any reason someone can't, what can they do?
So prenatal vitamins, like first of all, I always tell people that you can get everything from your food. What you eat, and that's what I talk about, what's the healthy diet in pregnancy, is the most important thing in getting all that you need. The vitamin is just a supplement to that, right? So like folic acid, we know helps a lot with the development of the spine of the baby and all that. And for people that have history in their family of having someone born with a spine issue, or they born with a spine issue, or any kind of defect, we increase the dose of the folic acid. So but then again, when it comes to, people ask me what exact prenatal vitamin, Dr. Trish, should I take? And I'm thinking they're all the same, to be honest. You know, it's how they're branded, how they're marketed. Vitamin is vitamin. They should have folic acid, at least 400 micrograms. They should have this, but everything is fine. But for women that can't tolerate it, like I couldn't tolerate it. When you have nausea and vomiting, trust me, either you just completely stop and say, God, give me the nutrients that I need, because I can't even take this. But I also allow them to take children's vitamins. So they can take the chewables, they can take the gummies. What kids are taking, they can take children's vitamins, and that should be fine. And then, like you said, in terms of diet, increasing their intake of vegetables, like green leafy vegetables, exactly. Eggs, fruits, and vegetables. Have a balanced diet. Yes, a proper balanced diet. You know, if the craving allows you to. Yes, if you don't, exactly. Oh my God, pregnancy can be such a roller coaster. It's easy for us to talk, but we know those cravings can take over the meal. It can completely take over. Thank you so much, Dr. Chito. I mean, it's been very nice talking to you, and I'm so glad that this is not the last time we're having you here. We're going to continue to address the other parts of pregnancy and the things that we should know. So thank you very much. And so I hope you had a nice time. I hope you had, a lot of things to learn from this discussion today. We've had with us today Dr. Chito Nwana, the MD CEO of Tabitha Medical Center in Abuja. Before I go, I'd like you to write down one thing that you're going to start doing differently if you're an expecting mom, or if you are someone who is planning to be pregnant, from what you've learned today. Until next time on our Belle Chronicles, see you later. I remain Dr. Megor.